the Unconventional Dietitian, Daphne Olivier. Daphne, thank you so much for hanging out with us today.
Of course. Thanks for having me.
Absolutely. So we are kind of continuing our discussion. It's Thyroid Awareness Month. And today we are talking about certain things to test for when you get blood work done pertaining to thyroids.
Right. So your thyroid, usually it will often get tested just kind of in routine labs,
Yeah.
especially if you do an annual test. But usually the only thing that gets tested is a TSH, which stands for thyroid stimulating hormone. And ironically, that hormone is not even produced by your thyroid. It's produced
Okay.
by your pituitary gland to tell your thyroid to produce hormones.
Hmm.
So if you have any kind of symptoms related to thyroid dysfunction that you really feel like I need to dive into this thyroid situation a little bit more, it might be worth getting the actual thyroid hormones tested. And sometimes you have to ask for them specifically. So they kind of come in pairs. So you have the hormones that your thyroid produces, which is T4 mostly. It produces a little bit of T3, but we do need to know what both of those hormones are doing. So T4 and T3.
Okay.
T3 is the hormone that your body actually uses. So the thyroid produces T4, it has to be converted into T3 so that your cells can use the hormone.
Okay.
Then, if we're looking for Hashimoto's disease, which is about 80% of people that have hypothyroidism have Hashimoto's disease, then what that means is that there's an autoimmune dysfunction. So your immune system is attacking your thyroid. So the two labs that we would be looking for there is TPO, or thyroid peroxidase antibodies, and TG, or thyroglobulin antibodies. So TPO antibodies and TG antibodies are the two things that we would look at to see if the immune system is involved with the way that the thyroid is functioning.
This is all great information to know specifically what to ask for, because like you said, I had no idea that when you do those, like that annual blood work, that they're not really testing the thyroid. This is great information.
Yeah, they're just testing to see if there's a little bit something going on, but you can
Yeah.
definitely have thyroid dysfunction and have your TSH number be normal. So if you
Yeah.
have symptoms, it's worth digging in a little bit deeper.
Yeah, and we are almost out of time. Daphne, if people at home have any questions for you, how can they contact you?
You can contact me through my website, theunconventionaldietitian.com, or through Instagram or Facebook, The Unconventional Dietitian.
Daphne, as always, thank you so much for hanging out with us virtually to share some health tips with our viewers.
Of course, thank you.
Of course, if you at home, you want to learn more, head to our website, kdn.com. Everything you need is right there. We'll be right back after this.